Hello and welcome to Riverside Reflections. My name is Denise Mananis and I am the Associate Vice President for External Affairs for St. John's Riverside Hospital. Today's guest on our show is Dr. Ashok Chopra, and I'd like to welcome him today to our program.
Thank you.
Thanks for being with us today.
Thank you for having me.
So I just want to dive in a little bit and we want to get to know you a little bit. So can you give me a brief background of, how you arrived at the medical group and how you've been with the medical group now?
3 years now, yeah.
Oh, that went quickly.
Yeah,
so just give me a little background on how you arrived at this point.
I'm the medical director at St. John's Medical Group. I am clinical as well as administrative, 80% clinical, 20% administrative, managing the group. This is my third year here, and prior coming to St. John's Medical Group, I was working with Sinai doctors. I was there for more than 10 years in the same community, but I transitioned to St. John's Medical Group about 3 years back.
Okay. Yeah. So before we get into some other topics about the medical group, can you give me a little bit of a brief history of the St. John's Medical Group?
So St. John's Medical Group has been around for 15 years, and initially we started with few physicians. There was a goal to serve the community as these patients came out of the St. John's Riverside Hospital to provide them better care. Over the years, and especially last year, it has grown exponentially, and we have more than 45 physicians in the group now. We are onboarding new physicians as we talk, and we are talking to many more physicians in the community, those who want to be part of St. John's Medical Group. Yeah.
So that's very interesting to me because the growth this last year has been really exponential, right? It's gotten really big. But, can you talk a little bit about the change in the practice of medicine? Because, it used to be when I started at the hospital, all physicians were in private practice. So can you talk a little bit about, is that model of physician practices going away? What's happening there?
I would say it's not going away, but there's a major shift from being independent physician to become part of an organization or a private equity firm or a corporate, structure. And the reason for that is because of the rising operational cost, administrative burden on the physicians, decreasing reimbursement for the physician. There's a talk about work and life balance. I think as a private physician, physicians are spending more time at work and not much time with the.
So you're basically telling me why doctors are moving into working in a medical group. There are some really interesting benefits for the physician. So I want to talk a little bit more about that. So the work-life balance is a thing. Can you kind of tell me why it's become an issue? You mentioned decreasing reimbursements. So what were private physicians doing in order to keep patients coming in and making the same kind of living that they were making?
In the past, if we go back about 15, 20 years back, I think the reimbursement rates were very good for the physicians. But because of, healthcare is one of the most expensive spending in the country, and there's been decrease in reimbursement rate for the physicians. So now the physicians have to see more patients to generate the same amount of revenue which they were doing many years back. So previously, if they were seeing like 15, 20 patients in the office and getting good amount of money, now they have to probably see 30 patients to get the same amount of money. That makes them spend more time in the office and less time with their family. So that work-life balance that was there before has gone. So now getting transitioned to a group, basically like a St. John's Medical Group. The benefit is that we have a lot of colleagues, those who are working together. It's a multi-speciality group. We share calls, basically. Okay. The reimbursement rates are better for the group because collectively they get better reimbursement as compared to an independent physician.
Right.
And that work-life balance is there. So previously a physician used to be working late in the night, doing the weekends also, coming to the hospital, rounding on the patients. But in a multi-specialty group like St. John's Medical Group, you go 3 weekends you're free, 1 weekend you're working. So you get more time to spend with your family, and at the same time you're enjoying your work as well.
That's a really interesting situation that has occurred over the last 15 years. I mean, I've really seen it in the last 10 years because the acceleration of the formation of the group and the expansion of the group has really taken off. So, Doctor, let's talk about the expansion of the group. Tell me how big it's gotten. What kind of physicians, what kind of specialists do we have?
So at present, we are about 45 plus physicians, and we are about 10 internists and family physicians. We have about 4 or 5 gastroenterologists. Mm-hmm. We have orthopedic group within the group. We have podiatry within the group. We have a vascular surgeon within the group. We have pulmonary within the group. If a patient is part of St. John's Medical Group, and so he's been taken care of by the whole family, and they talk to each other about the patient. And I think that provides a better quality of care to the patient, and the patients are also happy that when they go to another physician, they already know about their case, basically, because they're also on the same electronic medical record where each physician can read each other's notes and provide a better care to the patient. Yeah.
I mean, I've experienced it in the group, so I thought that was a very important point to cover. I do want to now talk about the benefits. We've talked a little bit about the benefits to the physician, but the benefit to the community. St. John's is a very community-driven hospital. It is our mission of community service. We are community strong, right? So the benefits of accessing care through the medical group, can we just talk about that?
As you know, our St. John's Riverside Hospital, I think what was happening in the past that all physicians, independent physicians, used to be a separate entity, and not all physicians would be able to take the same insurance that the patient had, basically. Yeah. So a patient coming out of the hospital, coming out of the hospital wouldn't be able to access another specialty because of the lack of insurance, basically. So that was a very big point for the hospital, that the patients that we are serving should get a comprehensive care, and that was the goal behind forming the multi-speciality group, so that when they are discharged, or a community patient or a member seen in the group should be able to see all other specialty without any interference or without any issue about the insurance. So it's a seamless transition of care for a patient.
So this one is a little bit broader question about the growth of the medical group. In the last year, we went from 10 or 12 physicians to 45 or 47 physicians and counting.
Right.
Why do you think that is? What is the attraction to become a member for these doctors?
I think, first of all, I think the foundation is laid by the physicians, those who initially joined the group, and they could see that these are the quality physicians, those who joined the group, and providing quality care to the patients. And that was, and they also saw, that these, being part of a multi-speciality group, there was a better work-life balance. And I think that was one of the most, motivating factor for other physicians to join the group. As physicians, we always look at each other, basically. If Dr. Chopra has joined the group, everybody's watching, how is it doing? And if I'm a happy physician, and I'm happy, basically, so they would ask me, okay, let's,
That's great.
Yeah, so.
That's great. So to kind of wind up our discussion today, I really wanted to, we've talked about the community in terms of patients and the benefits. We've talked about the physicians and how the medical group impacts them. But I really wanted to ask you your thoughts about what the benefit the medical group brings to our community, our broader community, the Yonkers community, the Rivertowns communities. Why is it important to have the medical group here?
I think one of the most important aspect of having St. John's Medical Group and we are growing is to keep the care local. We've noticed that over the past many years, we went through a COVID-19 pandemic and, September 11 in the past. The local population suffered when a tragedy happens, like COVID-19. At that particular time, I think St. John's Medical Group, St. John's Riverside Hospital, I think provided, a seamless 24/7 care to our local people. And I think that is one of the main reasons that we want St. John's Medical Group to have a bigger role in providing care to our local population. Yeah. And also, I think we are training the future doctors.
That's great.
We have our residents from LECOM. They come and they rotate through our clinics to know, just to show them basically that we are taking care of our local population, so that they can imbibe that value in them, how important it is to be local and taking care of your local patient population.
So we've talked a lot about the growth and about the numbers of physicians that have joined the group, but we also have expanded our locations.
Yes.
Can you give me an idea of where everybody is?
So one of our biggest location is in Yonkers, 1086 Executive Boulevard. That's our main campus. Most of our physicians are placed out of that location. We have another location on 1019 Yonkers Avenue. We are opening up another location at Park Care, which we want to expand. Right now, we are starting with the gastroenterology.
Park Care is our Park Care Pavilion.
That is correct.
So it would be in the building.
Building, yes.
Yeah.
And we want to introduce primary care, gastroenterology, and we want to have a multi-speciality group to serve that population.
Yeah.
Apart from that, we also have presence, a big primary care presence in Dobbs Ferry Hospital. We have a primary care group, we have a podiatrist, we have pulmonary presence over there, we have orthopedic presence over there. We have another location in Hartsdale. We have two gastroenterologists, Dr. Marinino and Dr. Lafrano. They practice out of that location.
Both ladies.
Both ladies, and a great addition to the group. We have a big patient female population, and they feel very comfortable going to a female specialist. And having Dr. Lafrano, having Dr. Marinino, I think adds a lot of value to our practice, and we are seeing a great traction to our Hartsdale practice. And we also have a big pain management practice in Yonkers.
Yeah.
And Dr. Rosa, yes, he's leading that practice, a very busy practice.
Yeah.
And so we are very happy. We are very proud to have so many different specialty as part of our group. Yeah. We also have vascular. Dr. Tannenbaum is there. He
I'm
has
so
been,
glad you mentioned him.
Yes,
he came back to us.
He came back to us, a very well-respected physician in the group, and we are so happy to have him back. And,
yeah, so he does a multiple. Let's just talk about him for a brief second. He is a vascular surgeon,
right?
But he's also seeing patients in the Wound Healing Center.
That is correct. Yes.
Yeah, so he's wonderful.
Yeah, so I think we are growing, and there are things I can't tell you, but I think this, the practice is going to grow in next coming years, and it's going to be a very prominent practice in the region.
So our community should be watching.
Definitely,
they should be looking.
Definitely, it's all for the community. Yeah, we are doing all for the community so that we can keep the care local. That's our goal.
That's beautiful.
Thank you.
Thank you so much for being with us today.
Thank you, Denise. Thank you for having me.
You've been a wonderful guest. Thank you. And to our audience, thank you so much for joining us again today for Riverside Reflections. We'll see you next time.